A very good evening to you. Welcome back if you've been with us on The Full View on SABC News. Welcome if you've just tuned in. And of course, focusing on the President's speech tonight, announcing at 7 o'clock, as announced, exactly on time, the President saying that South Africa will move as a whole to alert level 3, but there will be a specific focus in terms of health provision for those hotspots. All right, we're joined by Angelo Fick. We were speaking to him earlier, political analyst, as well as Somadoda Fikeni. Thank you both for staying with us. And one question I wanted to ask both of you, let's start with you, Angelo, is did he get the balance right? Because we were talking about these polarized debates in South Africa, and one of them has become, do we focus on the lives lost or do we focus on the economy? But they're both about lives and livelihood. Do you think he was balancing these two very important issues?
So given who Cyril Ramaphosa is as President of the Republic of South Africa, I think this is going to be read by many people as balance. For those of us who are slightly to the left of where government is often found, and where so much of the society's public rhetoric tends to be, there's an assumption that somehow by some magic formula, ordinary people are going to come together and save the millions of South Africans who, because they live in the most unequal society in the world, they will simply be saved by a compact. And that, I think, has to be built. And what we have built over the last 25 years is a society of inequality that's not just economic, but an inequality of life chances. And so when we start thinking of what's going to happen in the months ahead, we need to be prepared, and we need to begin to prepare ourselves and one another for where these deaths are going to happen and what the consequences will be. We cannot have a repeat of what we saw in KwaZulu-Natal in the late 1990s and the early 2000s, where we have large numbers of deaths and we don't fully and adequately deal with the social consequences of the breakup of families, the trauma to communities, and the long-standing consequences of what happens to the people affected by those deaths.
All right, Somadoda, please answer the same question, but let's first quickly get a reaction from Pule Mabe from the ANC national spokesperson. Mr. Mabe, the ANC's response to the President's speech tonight?
Thank you very much, and good evening to your viewers. We do welcome the pronouncement by the President to move the country to level 3. The President has taken his time today to outline a number of measures that are being considered before we could move to a level. Part of what is important is that he has demonstrated that they are a caring government. They rely on the evidence that they are being given by epidemiologists on the kind of measures that are necessary to be undertaken to deal with this pandemic. We must all cooperate with government. Government will not be able to achieve all of the things that it is talking about unless it is supported by people on the ground. It is going to be the behavior and conduct of our people which is going to make sure that our own efforts, the efforts that are being undertaken by government to fight and defeat the spread of the COVID-19 pandemic is ultimately successful. That is going to depend on what the people themselves are doing on the ground. We're moving to level 3, easing out some economic activity necessary to make sure that we could be able to also make sure that there's activity in the country. This is based on the work that government has done. We have issued a statement yesterday calling on South Africans to support the work of the National Coronavirus Command Council. Each and everything that they are doing, all of the pronouncements that they are making, they are evidence-based. They are not necessarily driven by their own self-interest. No, these are issues that are driven by guidance of scientists, epidemiologists, and all of that. The President has said that today. He has taken his time to even announce the kind of consultations that they've had, taking the country in his own confidence, saying they've met with faith-based organizations, they've met with political formations. If you listen to him, Tepiso, they've basically met with every strata of society to make sure that the decisions that government ultimately arrives at is embraced by everyone in the rest of South Africa's people.
Mr. Mabe,
because
may I ask you, we're running out of time. The ANC was very strong on something before this speech, and that was the singling out of Minister Nkosazana Dlamini-Zuma, who reportedly has been a champion for the cigarette ban and certainly delivered that news to the public. What is your message? Because this issue will certainly remain contentious. There's a legal case pending, possibly more coming. What are your concerns around that issue of the minister herself?
Well, on a lighter note, Sebizo, I can tell you now that we ourselves was taken to the Secretary General of the ANC earlier on in the DSG. We ourselves have what you call black Twitter. We've been attacked sideways because of the statement, one pronounced by the DSG of the ANC on Saturday, the other one issued, signed by the Secretary General of the ANC yesterday. The positions that are pronounced by the Minister of Cooperative Governance are the positions of the National Coronavirus Command Council, which has been chaired by President Cyril Ramaphosa. So we need not isolate or remove Minister Nkosazana Dlamini-Zuma out of the collective she serves with. All of these things she's pronouncing on are part of the decisions of what government and cabinet shall have agreed upon. Now, what the ANC was saying was that it supports all of these decisions and that it is dismayed by the kind of pronouncements that are being made. Actually, the Secretary General of the ANC will be speaking tomorrow, having reflected on the decisions and pronouncements that were made today by the President of the Republic of South Africa, and say these are the things that we believe should be done by citizens to support government. Remember, while we are calling for people to make certain sacrifices, we are not going out there to create an untenable environment for citizens. We are doing this to save lives.
All right, thank you very much, Pule Mabe from the ANC. Let's return to our analyst, Somadoda. I was asking you, do you think the president achieved that almost impossible balancing act of focusing on the health of individuals, the fact that many more people are going to die, versus the livelihoods, the calls for the economy to be reopened, for people to be able to live their lives and work?
Well, I do think that this is a very complex, unprecedented situation. And in each one of the messaging, an effort to make that assurance that you're still going to have a peak, and at the same time government is going to work with the social partners to intervene in the rebooting of the economy has always been there. Let's put this in context. Very often we punish ourselves unnecessarily when we compare with the most advanced countries in the north, USA, Britain, Spain, France. We are all in this together, and there is no longer this notion to say look into the advanced countries, because some of them have gotten the messaging wrong, the coordination wrong. Therefore, our homegrown approach, which is also taking from some of those models, have tried to do the balancing act. But what I want to mention here is that going forward, what is missing in the message is the kind of socio-psychological intervention which ought to be in place as people deal with the consequences of this disease. And the second one, a social compact where the nation must seize this opportunity, which has exposed some of the difficulties and the legacy issues we have not dealt with, and have that kind of a socio-economic codessa to deal with the social ills, with the economic ills of our society. Because if we deal with economic growth incrementally, you're still going to have inequality. You're still going to have poverty, and other people will say you talk recession when the rest of the majority has always been in depression.
All right, thank you very much. Let's go. Please stay with us. Somadoda, DA interim leader on the line. However, John Steenhuisen. Mr. Steenhuisen, thank you for joining us. The DA's response to tonight's address.
Well, certainly we welcome the opening up of the economy. I'm sure, as you know, we've been beating this drum for the last few weeks. I think that it should have happened a little bit sooner. But nonetheless, level 3 and getting businesses and South Africans back to work so that we can try and avert an economic depression is a good thing. I think the hotspot model is certainly the right way to go, and focusing on those hotspots using medical and pharmaceutical interventions is to be welcomed, and throwing resources there. But a number of things that need to underpin this, of course, is making sure that we're ramping up testing, tracing and tracking, and working on turning around the turnaround time on test results. Waiting 72 hours or longer for a test result is going to make dealing with community transmissions and sustaining the quarantining of them very, very difficult. So that's going to have to be some key focus. And then, of course, the tobacco ban that remains in place makes absolutely no sense from either epidemiological or an economic perspective. But certainly looking forward to getting South Africa back to work so that we can start to deal with the twin threats of the spread of the virus, but also loss of livelihoods and the destruction of the economy, which we need to try and avoid at all costs, although many economists fear it's too late. But certainly getting the economy moving forward is the right thing to do.
Will you drop your challenge now to the National Command Council, the way decisions are being made, your concerns about the Disaster Management Act?
Absolutely not, because they are dealing with the constitutionality of the Act and its complete lack of sufficient oversight by the legislature of the executive. And we need to make sure that whatever disasters await South Africa in future, that Act is brought in line with the Constitution. So we will certainly be pursuing that. We will also be pursuing the cases relating to military curfews and the ability to be able to put them down, as well as the restriction exercise, because as the President said this evening, there are some instances where people may be moved back into level 4 or 5, and we need to make sure that those a military curfew and limiting people to 3 hours of exercise in the morning is not enforced in those levels 4 and 5.
Yeah. Well, the Western Cape itself is particularly vulnerable there. Are you relieved the Western Cape is moving to level 3? Will you accept that if those infection rates aren't brought under control, it will be moved to level 5? There will be a differentiated approach.
Well, of course, and that's always been the smart lockdown model proposal that we put before government, and we're very lucky in the Western Cape because we've been able to test at levels that very few other parts of the country have been able to match. It gives you the data sets to be able to move and make those determinations. Unfortunately, in many other provinces, that's not the case. But needless to say, I think it's good that we're opening up. And of course, people must remember we are going to see a spike in infections. The spike was always going to come. The hard lockdown was merely to buy you time to prepare your health response for that. And so those spikes will come in the Western Cape and in other provinces.
Is the DA concerned? Are you embarrassed about what's happening in the Western Cape? Does that point, the infection rate, the claims that people are not following lockdown regulations, does it point at all to political leadership in the Western Cape?
Absolutely not, and I don't know how anyone could be embarrassed by the spread of a pandemic. It's I think the Western Cape is certainly way ahead of the rest of the country when it comes to testing and tackling the community infections. The Western Cape has been actively going out to look for those community infections, whereas many other provinces have not. The Western Cape's turnaround time on testing is better than any other province. So the Western Cape is finding these virus cases because they're actively going out to look for them. Can I stop
you there? Because the health minister said something different, that not enough focus on contact tracing, etc., is being done in the Western Cape.
Well, I'm talking about testing and being able to get those test results in that give you the data sets. The Minister of Health should be concerned about that in all parts of the country, because when you wait more than 72 hours for a test result to come back, it makes tracing and tracking exceptionally difficult, and it massively ramps up the number of people that those individuals whose tests do come back positive have a contact of infection with. So I think the National Department of Health should be focusing on turning around that testing time much quicker. We rely on the National Health Laboratory Service, falls directly under the Minister of Health's responsibility, and he should be doing more to get the turnaround time improved so that you can precisely do what you've just said, being able to trace and track far more effectively.
All right, thank you very much, DA Interim Leader John Steenhuisen. And let's go back to our analysts, Angelo Fick and Somadoda Fikeni. Angelo, we were talking about opening up of the economy, but of course this comes with restrictions. Big companies have to be very careful. A third of the workforce can come back, and that's much harder, isn't it, as you believe, for smaller companies?
For smaller companies, but also across various sectors, because unlike other parts of the world where government regulations and an inspectorate is in place to ensure that government regulations are adhered to, we know that in South Africa, with the precarity of workers, with the ways in which workplace conflict is resolved, many people are going to work because they have no other choice and may not be able to, among other things, institute the kinds of demands that should be in place for people, because they now have to make very tough choices about either reporting workplaces for violations and thereby losing their income, or risking it, as people have been telling us for the last 50 odd days, of going to work knowing that they could become infected because their children are hungry. These kinds of choices are, I think, not good. For smaller businesses, as you pointed out, it is going to be difficult because they will have to begin to think of what amount of their current income that has been delayed by 50 days they're going to spend on these protective measures, who is going to pay for it, and also how the supply chains will be impacted on various sectors maybe not being able to be as responsive as others. So this all works really well on paper, but how it works out in a country with the kind of inequalities and the history of not adhering to regulations across various sectors, that's going to be tested. And it's going to be tested in businesses, it's going to be a test for workers, it's going to be a test for managers who may be in a space where they will have to protect the corporation rather than adhere to the law. And that, I think, is an unfortunate choice to give to ordinary people on a daily basis.
Yeah, so very tough for small businesses, tough for many workers like the hairdressers, the beauty technicians who still aren't going back to work. There has been a concern about those particularly vulnerable women. I'll come back to both of you, but we continue to get political reaction to the President's speech tonight. And on the line we have Peter Groenewald, FF Plus leader. Mr. Groenewald, thank you very much. Your response to what the President had to say.
Well, firstly, we say that we don't have the detail. It all depends what is going to be in the regulations. We know from the past that the President says something, but when we receive the regulations, it's something different. The Freedom Front Plus's view has always been that after the 21 days of lockdown, that we should open the economy, and we said from the start there that the approach should be to put certain health protocols in place, and then those businesses, whether it's big businesses, whether it's small businesses, whether it's micro businesses, if they can comply to those health protocols, they should be allowed to do business. Now, the approach from the President is in that direction, but again, we still have to see the fine detail. He's referring to sector proposals, or shall I say protocols. We don't know what those health protocols is going to be as far as a specific sector is concerned. You refer to the very micro businesses, the sole proprietor businesses like hairdressers, beauticians and everyone. If you look at the draft regulation, it says yes, they will be open or be able to open if there is at least a 1.5 meter distance between their clients. But still, we will have to see what the regulations are going to determine. The damage to the economy is huge. These steps could have been taken before. We didn't have to wait till tonight to hear what is going to happen on the 1st of June. We are in the process of a court case where we say that we are going to continue with our court case, to have this approach fully to its potential, to put the health protocols there, as well as the fact that there's total lack of parliamentary oversight on the whole process of this disaster, and that there's no accountability from the specific minister, in this case from Kochta, towards the Parliament and the people of South Africa.
All right, thank you very much. That was FF Plus leader Peter Groenewald. And I'm sure most of you heard what the president had to say. If you weren't able to hear that address tonight, let's just recap what has happened. We are moving from alert level 4 to alert level 3 as a country. That happens on the 1st of June 2020. As you can see, alert level 3 still means strict precautions to keep transmission low, additional measures to contain outbreaks in hotspots, and the president outlining where those hotspots are, some of them in Gauteng, many in the Western Cape, which of course still accounts for more than half of all the confirmed infections. What we do know from the president's address is that now alcohol sales will be opened up, restricted hours, however, the sale of tobacco will remain prohibited, gatherings remain prohibited except for funerals, but that cap of 50 people still stands. And what's happening now is the differentiated approach is coming through in terms of the health focus. The Cuban doctors, reinforcements sent to the hotspots and the worrying areas. Business travel locally will be phased in. That still needs to be outlined how that will work, but the main borders remain closed. Transport of goods, except for transports of goods and repatriation. All right, we have the UDM's Bantu Holomisa on the line, getting more political reaction. Mr. Holomisa, your reaction to the president's address?
The UDM welcomes the return to work approach. The president's speech, however, will require that people and business in particular and labor must be more responsible and be disciplined. Like he had said, the people must take responsibility of their lives in a way. So, however, let us hope that the relevant ministries would produce regulations which are in line with the president's outlined plan. We should welcome that perhaps some of the areas which would have come under level 2, the chances are that some have been incorporated under level 3. So that should be welcomed, and I hope that these hotspots would be attended quickly, and that the people in those areas would adhere to the regulations, so that by end of June at least, we should be talking about coming back towards complete normality.
All right, thank you very much. The UDM's Bantu Holomisa, the EFF, we did reach out to them saying that they will release a statement in response to the president's address. All right, let's go back to our analysts, Somadoda Fikeni and Angelo Fick. Somadoda, let's start looking at the political reactions. You've been hearing them tonight. You can comment on any one of them. But the DA, the opposition party, still going ahead with its challenge of the Disaster Management Act and how the National Command Council is making decisions. Is that a good move?
Well, I don't think so. We are moving into a period of a major crisis as a country, not just a health one, but a socio-economic one, which will need maximum unity, which will need a social compact. That you happen to have at least two prominent parties whose base is often, referred to as mainly white constituency, taking this particular legal action might actually in the long run isolate them. But also the fact that only a year ago, DA was able to master mobilizing opposition parties towards some of the positions and working together with them, and now it is prepared to go it alone in the municipalities, go it alone in this particular case, is also a signal that coalition politics either will take a sharply different form among the major parties, or it is the beginning of the end of whatever we've seen in the past, at the time when some local government, election outcomes may actually be needing some of those coalition arrangements. So this in itself can also be understood, the fact that the constituencies are the ones putting pressures in some of the political parties, and the levels of suspicion that if you give the ruling party the time or the government the time to run with this particular program, it may emasculate opposition parties. All those are coming to the surface.
Angelo, do you want to comment? I mean, initially there seemed to be an incredible consensus or a lack of criticism from opposition parties supporting our COVID-19 efforts. Now we do have these divisions, and maybe you can comment on what Somadoda said, that sometimes it feels like this is becoming a racial issue because of the opposition parties involved.
So I'd like to agree with something that Somadoda said earlier, which is that with local government elections on the horizon, the kinds of constituencies that are often invisible to ordinary South Africans on a daily basis, large business, corporations, and their influence on political parties, I think has come to play here. What I find interesting in listening to the different political parties is which of them uses words like people's lives and which of them use words like people's livelihoods. And those are, for me, very important distinctions to make. There are certainly no livelihoods without lives. And while we have heard from several sectors, not political parties, that people are going to die and those who die are expendable in one way or the other, we've heard it internationally as well as locally. It's one thing to say that at the level of a set of numbers or dots on a map, but I think it's very different for many of us who have people who live in the areas in which people are dying, people whom we know have already died, and people that we're related to, that are in our lives, who have comorbidities, who are elderly, whose demise is not just going to be a number. It's going to be something far more traumatic and will affect not just our emotional lives, as Somadoda pointed out, but will affect our ability to participate in an economy. And that, I think, is something that is often lost in this Gradgrindian, often quite Malthusian approach to life that says the economically viable must return, deaths are going to happen, we will cope with them when they happen. That kind of thinking is, I think, false. It's misdirected, and it will cost us in the long term because we're seeing what's happening with the consequences of that kind of thinking elsewhere in the world.
Yeah. Well, very quickly, before we release both our analysts, Angelo, do you think that the debates that we're seeing will change once the death toll rises, once many people become personally impacted by this virus?
I think for ordinary people it will shift, but I suspect that for political organizations it's going to become the major political football as we've seen in other parts of the world. And that will be a really big tragedy for ordinary South Africans. Because I think what needs to be focused on here is keeping people alive, minimizing their risk of death, and minimizing the consequences of this disease for the majority of people.
All right. Thank you to you both, Somadoda Fikeni, Angelo Fick, our analysts tonight. And we say goodbye to them. We continue, however, with the political reactions to the President's speech. On the line, we have COPE National Spokesperson Dennis Bloem. Mr. Bloem, your reaction?
Good evening, and thank you very much for having us. We have always said that we will always support gradual easing of the lockdown regulation. This is not an easy matter that we are faced with. This is between the saving of lives and the saving of the economy. But we welcome this announcement tonight by the President that the opening of the economy. We have seen over this 10 weeks how poverty have ravaged amongst our people, children and everything. But that's why we are saying that let us go back to work, but we must also, as citizens of this country, exercise discipline and more responsibility for us to save lives. It is here in our hands, as the President has said. We must not be careless. We must not do things that will put our lives in danger. One thing that we want clarity on and more explanation is this decision of the lifting of the ban of alcohol and then keeping the ban of cigarettes. It needs more explanation because we don't understand very clearly what was the rationale of this decision. Because what we see now, the black market on sales of cigarettes is a total disgrace. People are being ripped off, the smokers. People are paid up to 150 rand per packet of 20.
So, Mr. Blum, do you disagree then with the ban on cigarette sales?
I disagree with this decision that alcohol, you see, when we are saying we are taking expert and scientist advice, we must then, both of them were banned and now one is lifted. Now we want further explanation why the one is now lifted, the ban on one, and the other one, the ban is still intact. That's why we are saying we need more clarity on it. If we can get more explanation from the experts and from the scientists, then we will be satisfied. But to discriminate the one against the other will definitely cause serious problems in society. That's what we are saying.
All right,
the other one that we are very happy with is that our borders will still be locked. That is a very positive thing that we agree with.
All right.
But we are also feeling very, very sad that restaurants and bars and so on are still not operating. We must know that it is the economy of those people, the workers, the owners, and so on. We must. We are feeling for them as the Congress of the people.
All right,
that,
thank you.
They are going to lose their jobs.
Thank you very much from COPE, Dennis Blum. And we continue to bring in lots of the political reaction, bring you more analysis. Stay with us. We take a short break.
When we get information in WHO, we get information in numbers. This many people died or this many people had been infected. We don't see the numbers. We see the individuals behind the numbers. The mother of somebody, the father of somebody, the daughter of somebody, and the son of somebody, or the grandfather of someone. This virus is dangerous. This virus is public enemy number one. If we take this as a common enemy for humanity and give our best, we can win